Hi, so this is the next video. This is the opportunity we have for getting the staff's roles and responsibilities in terms of doing the exact examination. So, depending on which technologies your office has invested in, we'll go through them pretty quickly in this one because this is not a training video. This is more of an orientation video towards the process. But typically, there are three technologies that make up what we call the core tech, or the core tech is known that way because it produces the core score. And very simply, what we're really looking at are patterns of stress that have gone deeper and further into a patient's processor. Just think of the spine and the nervous system as if they're the computer that runs the body's reactions. And so just in the same way you'd like to run a scan on the performance of your computer, the technologies we have are exactly that. They run a scan on the performance of the connections of the nervous system within your spine, whether it's going to the muscles or to the glands and organs. But we also run a super test, which we call the heart rate variability. You may see it as what we call the pulse wave profiler too. And that one gives us a view as to how the overall perspective of contained stress, of overall stress in a person's lifestyle choices, is also impacting that performance that we talked about. So let's talk first about the surface electromyograph. It's the one that has the wires, and we actually touch them on the spine, and we're measuring millionths of volts. That's a fraction of a volt. That means that there's a tiny, tiny current that's running from the nerve into the muscle. And I'll ask you this. Is that surface EMG, as we call it, is that surface EMG measuring the muscle or the nerve? Well, the answer is the nerve. We're attaching it through the skin and measuring how the muscle is contracting, because it contracts a little bit as we sit there. But it's actually the activity of the nerve it's measuring. And so these nerves are constantly sending out tiny, tiny, tiny signals that make the muscles contract. And so we can measure those and see how tight the muscles are, but more importantly, how much energy that nerve is wasting to do a simple task. And so it's going to show up when you work from C1 all the way down to S1, which is the tailbone. We're going to see how much energy is being used, if you would, at every level. And it's going to print out some really cool graphs that show whether there's a lot of color, red. That means that there's over 3 times the amount of activity in that nerve and muscle area. Blue 2 times, green just slightly above normal, and white or clear, which is normal for the amount of energy in that task, which is simply sitting. So we know exactly with those white bars that a patient sitting, generally, just upright enough, is going to spend a certain amount of energy, and we're going to compare that. And then there's a number of different graphs that allow us to look at the different data, as we will say, of how those energy patterns are distributed, whether they're shifted to one side. And these are the things that your doctor is really going to contribute to it. Most importantly, when a patient has that done and asks you what do the colors mean, say that this is the amount of stress that your body holds in the muscles. It's affecting the muscle tone. The second test that we typically report upon is the thermal scan. Now, the thermal scan is a very sophisticated piece of technology that measures just in fractions between the right side and the left side temperature differences. You should know this, that it's much, much, much less than 1/2 of 1 degree that is being measured from one side of the spine to the other. And if there's a fraction of a difference that's in that area and it stays like that, this sensor will pick it up. And that tells your doctor that this pressure that a patient may or may not feel in their spine is actually tripping switches that go further into the connections that go into the organs, glands, and blood vessels. So it's pretty important that we get that data, because it tells us how sick the patient could be getting and wouldn't even be aware of it. And the third test is the one where we stick their hand in a sensor. That's called pulse wave profiling. It's actually much like if they put the leads on your heart, and that is called an electrocardiogram or an ECG, EKG. And what we do is that we put the hand in this, and we have the patient sit there for 5 minutes, and we just let them rest. And at rest, we check that beautiful heart rate that they have over that 300 seconds or 5 minutes. And then we run all of that data through a very big, complex computer program. And what it does is it shows us whether or not they literally are sitting there with their foot on the gas pedal, or whether they are sitting there with their life on a brake pedal. And again, your doctor will be able to tell you that. And if a patient asks you what it means, say, listen, this is a test that tells us that your stress levels are beginning to take over your health. And so the doctor will want to be talking to you about the choices that you've made, whether it be your exercise choices, your dietary choices, or your rest and recovery choices. Those are important things that you can say to the patient with HRV. I should back up and say things that you tell the patient with the thermal scan are, we're checking the connections that go from your spine to the organs of your body. Your doctor will want to be talking to you about how deeply this is affecting your symptoms or your health. And they might ask what they mean by organs and say, well, you would say things like your digestive system. We would talk about your breathing and your cardiac system. Maybe even we'd be talking about things like your headache patterns, because that's what the HRV, the thermal can give us some windows into. The fourth test is what we call inclinometry. And inclinometry is where we have the two sensors and we place them at different parts of the spine and then have you go through a series of different movements of the spine when we measure it. And inclinometry is really a beautiful system that allows us to enjoy understanding how the deepest stresses in a person have actually begun to lock up the movements in a person. Now the great news is that as soon as adjustments start, it's one of the first of the sensors to show that recovery. People, when they get adjusted, go, oh, I feel like I'm getting my energy back, but I also feel like I'm getting my movements back. So that's a great one. And the fifth that we offer in the suite of technologies is something called algometry. Now, it's one that the doctors rarely use unless the patient has projected an injury of some sort, and it's a pressure switch, and what we do is we press and then determine how much pressure it takes to move that point from feeling just pressure to where they go, ooh, that hurts. So from pressure to pain, and we can actually map out. So if a person has an injury, it doesn't take much pressure to get that pain pattern coming up. On the other hand, if they have a healthy response, you can press pretty hard. Obviously, we don't want you doing too much pressure. But we'll use that to try and do what we call pain mapping, or symptom mapping, however you want to describe it. And so if a patient asks what you're doing with that one, it's very simple. What we talk about mostly is the doctor will be testing to see if the pain goes beyond where you are feeling it. And that's such a simple test. So there are the 5 different tests that you have at your options. Most doctors, as I said, work anywhere from the first 3 to the full one, because when you start adding SEMG, thermal, and HRV together, you get to do what we call the beautiful core score. And it's the world's most leading technology and reporting system on what is known as the neural efficiency of that processor we've talked about. So stay tuned and we'll go to the next one.